Erectile dysfunction impacts 50% of all men by the age of 50 and will increase by 10% for each decade of life thereafter. This condition can cause a sense of embarrassment and shame, which have kept men from seeking treatment or medical help.
The numbers are really distressing. I'm 69. By my age, 70% of men have erectile dysfunction. I prefer to use the phrase erectile fitness because we all want to be fit, and fitness precedes dysfunction. How can we stay fit? How can we maintain our fitness and stave off erectile dysfunction? One of the problems, the way in which we as a society approach erectile dysfunction, is that men go online and get meds. Well, that could be a reasonable decision for someone who's 30 years old and in good health, but it's an unreasonable decision for someone who is 50 or 60, has diabetes or hypertension, because you could be overlooking a significant healthcare problem. Why is it important for patients and doctors to both engage in a conversation about sexual wellness? Well, there are two profound reasons. One is our sexual wellness is vital to our self-esteem, our happiness, our success in our relationships. And the other is more physical and disease-driven, in that if we are having difficulties, they can indicate that we have a vascular problem. And if the doctors are reluctant to initiate this, it's really up to the patients to do it, and vice versa. One of the great things about the 21st century is that we're living in an age of wearables for health. We have devices that people can put on their fingers to measure the oxygen content of their blood, to measure their pulse. And we call those things wearables. People can measure their sugar at home. You can have a digital scale at home and get on. And you can see these numbers. And if these numbers get worse, my blood pressure's gone up, I've gained 20 pounds. You'll be motivated to take action.
Sexual health is kind of a final frontier for that, right? I mean, we know our heart rates, we have EKG readings through Apple Watches, we know when we're asleep, we know how many stairs we did, we know the quality of our sleep, we know so many things, and yet this area that people really want more information about and external validation about, we don't have many ways of providing people with that information. And I think this is really going to revolutionize that space.
There are a lot of different options that people can use or try for erectile dysfunction before they jump into medications like pills, injections, and penile implant surgery. Those products can vary in terms of quality and in terms of what people are actually aware of exist. A lot of men will seek help in the healthcare system when they're sick or feel like they need to be fixed or have some sort of dysfunction. And what is much more of a taboo topic when it comes to men and their health is just wanting to perform better and not having to have a problem in order to seek some sort of help in the healthcare system.
If we could provide men with data that would alert them to where they stand on this progression from erectile fitness to erectile dysfunction, it would motivate them to comply better with their medications, seek medical help, drink less. It could even motivate them to improve the quality of their relationships.
Making the conversation positive by transitioning from impotence and performance anxiety to erectile fitness and performance enhancement, FirmTech is dedicated to improving men's overall sexual health. FirmTech focuses on developing products that encourage fun and enjoyable sex for men of all ages, while also empowering them to better understand their sexual wellness.
I formed FirmTech because I wanted to deliver products and tools to men that would help them have a lifetime of lovemaking that they and their partner desire. Built a team of bioengineers and very progressive urologists, and we have developed 2 transformational products to help men. We did this in 2 areas. One is we changed the form of the erection ring. We've also added sensors to it, so we now have a smart erection ring.
These devices reduce outflow of blood when you're at your maximum erection, which will help you maintain longer. So that's a benefit to all of them, but they can be uncomfortable.
It works. It will sustain an erection, but it's made out of a hard plastic. It doesn't enhance pleasure. It's not necessarily comfortable for your partner. Our performance ring is made out of a soft elastomer. The great thing about an elastomer is that it is adaptable. It doesn't pinch your skin and will adapt to any size. This can simply be wrapped on. It does not interfere with the arterial blood flow. It lightly constrains the venous return. What does that accomplish? It leads to a man having more control of his erections. It also heightens pleasure.
It's very comfortable, very easy to put on, and very secure. And then this next level of device is essentially the smart ring technology.
Our second product, which is the Tech Ring. puts smart sensors into this?
There are several advantages to the tech ring. One is the tech ring can be left on for longer periods of time. With the existing penile constriction bands, they can't be left on for any longer than 20 or 30 minutes. If left on too long, they can actually cause significant swelling, be difficult to remove, and cause injury to the penile tissue. The other advantage to the tech ring is that it actually provides information to the man and his partner about his sexual health. It's going to tell that guy how often he's getting erections, how good the erections are. So all of those factors are things that men want to know about their bodies. It's just there's nothing on the market right now that puts the control in the hands of the man and what things he can do to optimize his sexual health.
This is the first smart underwearable. It will give men important data that will help them and the healthcare providers take better care of themselves so they can enjoy a lifetime of lovemaking. Stay fit, get firm, FirmTech.